Issues that can be measured. So I'm going to talk now quite extensively about different biomarkers that we can use to determine, a clinician can determine if a patient has been spiked heavily. And we'll start out with some of the basics. When you walk in the door to your doctor's office, there's probably one thing that they check right away, and that's your vital signs, blood pressure being one of them. So the blood pressures can spike. We've seen this in acute phase SARS-CoV-2 infections where you have this intermittent spiking of blood pressure can get very, very high, sometimes associated with headaches and feeling fatigued. But it spikes and goes away. It's not idiopathic blood elevated hypertension or essential hypertension. It's this thing that spikes. It may spike for weeks or months and then disappear. And so that's been shown to be also a problem with some people who've been vaccinated. And we do know that elevated blood pressure lowers your life expectancy, especially if it gets really high. Resting pulse, the rates of that are a marker of aging. So increased mortality, increased aging with a higher pulse rate. And just an aside, there's been a surge in atrial fibrillation, AFib, a flutter. I've never seen so many ablations for AFib that's not managed very well with medications in the last 5 years. It just kind of came out of nowhere. And I think there's a link between that and the spike. A resting heart rate that is elevated is a risk for heart disease and has been linked to some spike issues. Homocysteine. Now, the reason that that's spelled with that little E in there is that the British, and I know there's a UK audience here, so I got to be mindful. So the British spell homocysteine with an E. In the United States, we leave that E out. So it can be spelled either way. HCY is the abbreviation for it, and it's related to spike in a bidirectional effect. In other words, people with high homocysteine levels tend not to do so well with the spike injury. It reduces their quality of life. It reduces their life expectancy. It can be a setup for increased heart disease, renal disease. See a lot of renal damage with high homocysteine levels. Cardiovascular disease, in and of itself, and a measure of inflammation too. Cerebrovascular accidents, peripheral vascular disease, and poor detox pathways and poor cognitive function. So we know that high homocysteine levels are to be challenged and brought down. And there are several interventions. Usually your B complex methyl donors will help bring the homocysteine down. There are some genetic issues like MTHFR variant can cause an elevation of homocysteine. So can CBS and some other genes as well. It's not just MTHFR. But the spike affects the health of people with elevated homocysteine, and people with elevated homocysteine are more likely to have problems with the spike injury.